this is our room scan just to show that I don't have any materials or anything. Can we get the floor too, Nora?
Yep.
I guess to be lower.
Yep. Okay, we're all good.
There we go.
And then behind you, I think that's you behind.
Oh. Shit. Okay, whenever you're ready.
All right, so I'm gonna knock, knock, knock. I'm gonna hand sanitize and enter the patient's room. Hello, how are you doing today? Good. Good. My name is Rachel. I'm gonna be your student nurse today. I have orders to do a head-to-toe assessment on you, just to check all your body functions. Before we get started, can you go ahead and verify your name for me?
Sarah Smith,
And your birthday?
42777.
Thank you, Ms. Smith. So I'm just doing kind of a general survey, making sure that you're not in any distress. I don't see any devices that I need to be worried about, IVs, lines, tubes, drains. You don't seem to be in any distress. So before we start out, I'm going to go ahead and check our safety equipment, okay? All right. So I'm checking the suction, making sure that all my hoses are plugged in. I've got the Yonker hose. I have the canister. I'm going to go ahead and turn it on. Okay, so the suction's not working, so I would go ahead and address that immediately because that's a pretty big concern. We've got the oxygen on. Good. We have a little Christmas tree. We have the Christmas tree for the room air. That's working. We've got an ambu bag with all the necessary pieces. Good. So I would go ahead and get a different suction before we started just to make sure because that's a really important safety device. Okay, Miss Smith, I'm going to go ahead and raise your bed, okay? Okay, the bed is not raising either, so that seems to be broken right now. Ideally, I would raise my patient up to a proper level so that I could begin working with her. Let's go ahead and start out. So I raised the bed. Miss Smith, do you mind answering a couple questions for me? Okay. So can you tell me what date it is today?
The 23rd of September 2021.
Great, thank you, Miss Smith. And can you tell me where we're at today?
We're at Sac State Medical Center.
Perfect. And what brings you in today?
Not being able to go to the bathroom.
Not being able to go to the bathroom. Number one or number two?
Number two.
Number two. So you're constipated?
Yes.
Okay. I definitely want to assess that later in our assessment, but I want to make sure, are you in any pain right now?
No.
Okay, good. That's the main thing. So let's go ahead and start out. I'm going to start at the top of your head here. So can you just turn to the side for me? Excellent. Go ahead and turn to the side. Okay, so your skin is nice, warm, dry. I don't see any lesions, no devices that I'm noting on there. Perfect. Let me just check behind your ears as well. Good. I just want to make sure there's no skin breakdown since we have the lovely masks on. So that looks great. Let's go ahead and I just wanted to ask you, are you having any symptoms like dizziness, headache, fainting? No. Nothing like that? Okay, good. Let's go ahead and do your eyes. So if you can just focus on me, I'm just checking to see if your pupils are reactive to light. Good. And this side. Good. Okay, so your pupils are about 4 millimeters without the pen light, so that's great. They're nice, good round shape. I don't see anything going on with them. Very reactive to the light. Excellent. So let's also go ahead and start then with your mouth. Normally I would have my patient take off her mask for this, but we're just going to simulate that today. So Ms. Smith, you've taken off your mask. Can you give me a big smile? Excellent. So I'm just checking to see that your face is nice and symmetrical. Thank you, Ms. Smith. I don't see any signs of stroke or anything like that. And then can you go ahead and open your mouth for me? Perfect. So I'm taking a look to see that it's nice and moist inside. I don't see any dryness, any signs of infection, white patches. Her teeth aren't cracked. I would also ask her, do you wear dentures? No. No, okay. So everything looks good. Can you go ahead and swallow for me? Good. Okay, thank you, Miss Smith. All those muscles look like they're good, so you're not having any problem swallowing? No. Great. Okay, Miss Smith, let's go ahead and move on. I'm going to do assessment of your chest. I'm going to put this down, even though we can't raise the bed. All right, so just to provide for your privacy, I'm just going to pull your gown down just a little bit, okay? Great. Okay. So I'm going to make sure that I'm putting my stethoscope skin to skin in an actual assessment. So Miss Smith, I'm going to have you, I'm just kind of going to look at your skin here. Great. It's nice and dry, good for your color for your ethnicity, warm to the touch. I don't see any devices, line strains, tubes I need to be worried about. I'm going to go ahead and ask you, have you been having any symptoms like coughing, shortness of breath, pain in your chest?
No.
No? Okay. And if you had said yes to coughing, I'd do a sputum assessment, but we'll go ahead and skip that. So I'm going to listen to the apex of your heart. It's just right down here on the midclavicular line left of that and the fifth intercostal. I'm going to move your breast up a little bit. Just go ahead and breathe normally for me while I do this, okay?
Thank you.
Are you experiencing any? I'm gonna lay down flat. That's
Do you have any allergies?
Okay, great. I'm going to check your radial pulse with it.
abdominal pain? Any nausea, vomiting? Just
Very good. Okay. So nice, good rhythm, and it's very equal with your pulse. We want to see it nice and equal. That means there's no deficiencies there. So I'm also going to check your lung sounds, starting out with your front right here. Let's go ahead, and I'm just going to make sure I'm not putting it over any bones or anything like that. And when I place my stethoscope, go ahead and do a deep breath for me, okay?
To the hospital today?
All right.
in the right lower quadrant.
Oh, gotcha.
Good. Deep breaths in through your mouth.
Oh, okay. So I will make sure to
Good.
do a
And
full
listen down here.
assessment to double check whether we have any
Just a
other
little bit.
questions we can pay attention to, okay? So,
All right.
now I will review.
Making sure I'm not over any bones.
I will review.
One more.
Bowel sounds are normal,
Yeah,
but
so
Good. Okay. I'm going to check the sides of your arms, okay?
I'll be listening for about 5 minutes per quadrant. Alright, I'm gonna feel your abdomen and
Good.
I'll go 1 to 2 centimeters in depth. And if you feel any tenderness, just let me know.
Very good. Thank you, Ms. Smith. So normally I would also do skin to skin, but I want to provide for my patient's privacy. Thank you, Ms. Smith. I'll put this back on for your privacy. Can I have you sit up for me? I'm going to do the lung sounds on your back. Oop, let me pull that up for you. Okay. So I'm just going to do an assessment here, make sure, okay, her skin is good color for ethnicity. I don't see any wounds, lines, drains, tubes, any devices that I need to be concerned about, nice and warm and dry. So I'm going to go ahead and start listening to these posterior lung sounds. I'm going to start at the base of your scapula here, okay? Can you sit up really straight for me? Okay, good. So I just don't want to be on your bone. Okay, right there. Go ahead and do a deep breath for me. Good.
I will check your pupil. Please just looking at me.
Good.
I will
Okay.
just shine a line.
Right about here.
Both
Split
sides.
up for me. Push down. And push up.
Good.
Lift this leg up.
Perfect.
Down.
And this is a
Good,
rapid
Ms. Smith. Okay.
reaction.
So I'm
So
gonna
your
check the
pupil
Deep breath.
run
Okay.
equal and reacted to light.
I don't see
So under
any.
your
Very good, Ms. Smith. All your breath sounds sound normal. That's good. I don't hear any crackling, wheezing, anything like that. I'm just going to palpate for any signs of edema back here. Okay, your sacrum is good. There's no tearing or anything like that. That's how we want it to be. Let's go ahead and move on down to your abdomen. I'm going to let you keep this blanket here, okay, for your privacy. And here we go. Okay, so I know we mentioned earlier that you're having some constipation, but are you having any other abdominal symptoms like nausea, vomiting, abdominal pain, diarrhea? No, just constipation? Can you tell me a little bit about that? How long has it been since your last bowel movement?
5 days.
5 days, okay. And how often do you normally go?
Every day.
Every day, okay. Have you had any changes to your water intake or your activity levels, anything like that?
Nothing's changed. Everything stayed the same.
Yeah, okay, well, we'll definitely put a note in with the doctor and see what we can get to help you with that, okay? I'm just going to start out looking at your abdomen here,
I'm gonna go document.
just feeling really lightly. Okay, nice and warm to the touch. I don't see any IVs, drains, lines, tubes, anything like that. The skin is warm, dry, and good color for your ethnicity. I'm just taking an observation of the abdomen here, making sure I don't see any concavity, no signs of edema or swelling, everything, no pulsations, no lumps or lesions that I need to be concerned about. Now that I've done a thorough look at it, I'm going to go ahead and take a listen. So I'm gonna listen to your bowel sounds, okay?
And I was like, shit.
You'll feel my stethoscope 4 times. Just breathe normally, okay?
No, yeah, it was good. You got wrong, you got edema, you got the swallowing thing that we've been forgetting. You got all the checks.
Okay.
And the
So
general
your bowel sounds are normal, but if this patient was having constipation, I would expect there to be some hypoactive bowel sounds. So I'm gonna go ahead and do some palpations, okay? So we're gonna go
Oh, that was their, the even sections.
okay, I don't feel anything strange, no lumps, no bumps, nothing like that, all good. Let's go ahead and provide for your privacy down here. Good, I'll give you your blanket back. Let's go ahead and start with your upper extremities now, Miss Smith. Have you been having any pain, numbness, tingling in your upper arms, fingers? No? Good, okay. Let me just do a little check on you. Looks good. Check on you, looks good. Okay, I'm gonna just assess your radial pulses. I wanna make sure that they are equal. Great, nice and equal together, both strong, no abnormalities with that. And then I'm going to go ahead and do your capillary refill here. I'm just checking to see that you have a brisk return. Good. And I'm going to do your skin turgor. Just making sure that I don't see any tenting. Okay, good. So now I'm going to go ahead and do a strength assessment on you. I want you to go ahead and hold out your hands like this. Push up on my hands. Good. Push down on my hands. Good. Give me a squeeze. Perfect. Nice and equal in strength. That's what we want to see. So let's go ahead and move on to your lower extremities. I'm going to go ahead and move up this blanket, okay? Provide for your privacy. I'm just looking at both legs and I'm going to assess, okay, no edema in either of your legs that I can see. They're both equal in size. That's also something that I want to do on your arms. So there's no edema in either of your arms. That's good. I'm going to start off by finding your dorsalis pedis pulse. Okay, good. Nice and equal and strong here. And then your posterior tibialis. Okay, good. Nice and equal there as well. So I'm going to also do your calf refill on your toes. Ooh, they're a little cold. Okay, we'll get you some socks after this. They look good though. We're going to go ahead and do some strength exercises as well. Can you go ahead and lift your leg up, push down, push up. Good. Same thing on this one. Push up, push down. Good. Flex your toes towards your nose. Flex your toes towards me. Good. And you're not having any numbness, pain, tingling in the toes?
No.
No? Okay, great. Before we're done, let me go and pull this down for you, okay? Can you take a couple steps for me?
Yeah.
You're not feeling dizzy? Nope. Okay. Ensure your privacy here. All right. Back to the bed. There we go. And I'll cover you back up, Miss Smith. So, I'm going to make sure before I leave, your bed is all the way down, which of course it is. I'm going to make sure your side rail's up. I'm going to put your call light within reach. Have to go over here for that one. And then I would make sure that if you had any belongings on your tray table that I put that within your reach as well. If you need me, press that, okay? Before I go, is there anything else that you need? No. Nope. Okay, I'm just gonna make sure the bed's locked. Good. All right, and then Miss Smith, I'll be back within an hour to check on you. I'm gonna put in an order for some laxatives for you for your constipation, okay? All right, bye. Hand hygiene and document.